Good afternoon, everyone. Welcome to today's update on COVID-19 in Alberta. With us, as always, is Dr. Dina Hinshaw, Chief Medical Officer of Health for the province. Dr. Hinshaw will provide brief remarks, and then we will open the floor to questions.
Thank you, Tom, and good afternoon, everyone. Before I get to today's update, I would like to talk about COVID-19 guidance for singing, musical instruments, and dancing. We have heard questions from many groups, businesses, and especially music teachers and schools, asking if we have been looking at new evidence to update our guidance. These are activities that many Albertans have sorely missed. The arts play an important role in schools and in our emotional well-being, and the restrictions have been hard for many. We had originally severely limited indoor singing and use of wind instruments, as there was some evidence indicating that they may pose unique risks of transmitting COVID-19. After reviewing the spread of the virus and measures in place in other jurisdictions, we have seen emerging evidence that these activities can be done safely if rigorous and proper precautions are in place. We have therefore updated our approach to allow Albertans to enjoy these experiences safely while keeping measures in place to limit transmission. Updated guidelines are now posted online that allow limited band practices, singing and wind instrument concerts to occur, provided distancing, enhanced cleaning, and other precautions are implemented. Choirs may begin again with maximum size limits and masking while singing. However, audience singing is still not allowed, and congregational singing in faith settings is still discouraged. This is because it is easier to ensure that all guidance is rigorously and regularly applied with smaller groups, while singing in a larger group without these same ongoing rigorous measures could lead to large transmission events. I want to stress that gathering limits have not changed, and dance floors are still not allowed, as we cannot safely mitigate the risk of exposure with these activities. As we continue to learn more about transmission, we will update guidelines based on what the evidence tells us and how we see the virus spreading in Alberta. Turning to today's update, we identified 111 new cases of COVID-19 yesterday, and the provincial lab completed 11,979 tests. Sadly, there has been one death during this time period. The total number of COVID-19 deaths remains unchanged at 253, as one previously announced death has been removed from the total after it was determined to not be a death resulting from COVID-19. Losing a loved one to COVID-19 or for any other reason is heartbreaking, and I extend my sympathies to anyone grieving the loss of a loved one. Today, Alberta has 1,444 active cases. 41 people are in the hospital, including 6 in intensive care. As of today, the total number of Albertans who have recovered from the virus is 13,718. There have been 29 schools where an individual attended while infectious. So far, a total of 32 cases are linked to these schools. There are still 3 school outbreaks, and Alberta Health Services is working closely with these schools to investigate any close contacts. I want to reinforce that these schools are not a risk to their communities, and those still attending are not at greater risk of exposure. Anyone potentially exposed has been contacted and is self-isolating. We have also updated our outbreak list for all other settings. This now includes an outbreak on one unit at the Queen Elizabeth II Hospital in Grand Prairie, with 2 cases. Testing and contact tracing is underway, and the facility remains safe for patients and staff. Before I take questions today, I would like to take a moment to explain in plain language how COVID-19 infects the body. I have heard many questions from both kids and parents about why certain measures are in place, especially why someone who has been exposed to the virus needs to be away from others for 14 days. And I think it is important that we all understand how this virus works. COVID-19 is a respiratory virus. This means it can be spread when people breathe, cough, or sneeze, and tiny droplets of liquid go into the air. If a person has the virus, it can be inside those droplets and make other people sick if it ends up in their nose, mouth, or eyes. But you don't get sick right away. Once the virus is inside your body, it can latch onto a cell inside your lungs. If enough virus latches onto cells and gets inside them, they take over those cells and make copies of themselves, then another copy and another one, and so on. This takes time. Our immune system will be trying to fight the virus, and a lot of copies need to be made before reaching a tipping point where someone has enough virus to be able to infect others. In most people, it will take about 5 to 8 days before enough virus copies are made for symptoms to show. Sometimes it happens sooner, or it can take up to 14 days, which is why we say that COVID-19's incubation period is 2 weeks. A person is not infectious to others for the full 14 days. However, we cannot predict for sure if they will get sick and if they do, when that will happen. This is also why, if someone is a close contact of a confirmed case, we require them to stay home for up to 14 days, even if a test in this time frame is negative. It is entirely possible that they have the virus, and it simply hasn't made enough copies of itself to be captured by that PCR test that shows up negative. It is also why if you are sick, but not a close contact, and you test negative, you only have to stay home until your symptoms resolve. If you are already showing symptoms, the virus causing those symptoms should show up in the tests. By testing negative, it is most likely that you don't have COVID-19, and you just need to stay home until you are well enough to not get others sick with whatever is causing the illness. Also, staying home until you are feeling better is extra safety, as sometimes a single negative COVID test may be a false negative. I've also been asked about why we have such a long list of symptoms and why even kids with mild symptoms need to stay home from school. The answer is that COVID-19 doesn't affect us all in the same way, leading to a wide range of symptoms and a wide range of outcomes for the virus. For example, in some people, COVID-19 can cause a fever. This is caused by the immune system trying to fight the virus. It heats up the body, which raises the body temperature, leading to a fever. In others, the immune system causes inflammation as it is trying to defeat the virus. This is the reason that some people feel tired and achy, which is another symptom of COVID-19. In other people, COVID-19 may lead to symptoms such as shortness of breath or even pneumonia, as small air sacs in the lungs get inflamed and possibly fill with fluid. This stops oxygen from reaching the blood and is also a reason why people who get very sick with COVID-19 sometimes must be put on oxygen therapy or ventilators. Those are just a few symptoms. There are many other ways that COVID-19 can impact your body, such as causing a runny nose, sore throat, vomiting or diarrhea, or many others. All of these may be signs of COVID-19, and that is why we are asking students and parents to use the daily checklist and stay home if they are feeling ill with any of the identified symptoms. It's important to stay home even when sick with mild symptoms, because the virus doesn't impact everyone the same way. In one person, the virus may make a large number of copies, but only cause a runny nose or some other mild symptom. Yet when that same virus is passed to a grandparent, it could cause them to have a more serious illness like pneumonia. COVID-19 doesn't play favorites, and none of us are immune. We can all spread it to each other, which is why we are all in this together. I hope this explanation has helped, and I would be happy to take any questions.
All right, we'll go to the phone now. Operator, could you put through the first question, please?
Our first question comes from Sean Frenette of CTV. Your line is open.
Hello, Dr. Hinshaw. Several parents are telling us in Calgary that they are concerned about increasing class sizes because teachers are being repositioned, for example, to teach online hub learning, resulting in fewer teachers for in-person classes, and they're seeing classes grow to 30, 35 or more. How big is too big of a class size until it becomes unsafe, in your opinion, for COVID-19 to spread?
The question of class sizes is one that Deputy Minister Corbould had taken before with that specific question about as teachers are taken to or reassigned to online classes. Sometimes those students that are in person classes are put together. One of the important things, of course, in any context, whether school or anywhere else, is that as much distancing as possible is maintained between students. And also, of course, that other measures such as daily screening for symptoms, regular cleaning, hand washing, and all of those measures are in place. I know that Deputy Minister Corbould has talked specifically about some of the things that they are doing with schools and school boards to address some of these concerns. So that question may also be something that he'd be able to provide additional information on. And perhaps that's something that we can help follow up with the Ministry of Education to get more details.
Will do, Sean. Operator, could you put through the next question, please?
Our next question comes from Jesse Weisner of Global TV. Your line is open.
Hi, Dr. Hinshaw. Some business owners like salons where everyone wears PPE find it contradictory that they still have to maintain social distancing with their chairs while people in schools are quite close to each other. What do you say about this?
I know that businesses can find the restrictions and the guidance tiring and perhaps even frustrating. When we've developed our guidance, we've looked specifically at different locations and different contexts and developed what our best guidance is in those particular contexts. So for schools in particular, the guidance does indicate that when students are seated and quiet and able to maintain maximum distance from each other and are all facing forward, that in that context, mask wearing is optional. And what's really important to understand about that particular piece of our guidance is that that trade-off was made based on what we understand to be potentially some of the challenges with using masks in a learning setting and some of the challenges with respect to communication or effective learning. And we had made that allowance in order to balance, again, the potential risks and benefits in our best attempt to create the overall well-being of a school environment. In a salon, there's no concern about learning and communication issues while in a salon chair. And also, in a salon, you have many people coming and going, different people coming and going on many different days. Whereas in a school environment, again, you have that same cohort coming together day after day. So the contexts are quite different, which is why there is some variation in the guidance. And I would encourage any businesses that are wondering about making changes to their practices that do not align to our guidance, I would encourage them to reconsider, as the guidance that we've put forward is the best way to protect both their clients and their staff.
Operator, could you put through the next question, please?
Our next question comes from Julia Wong of Global News. Your line is open.
Hi, Dr. Hinshaw. Have there been any recovered Albertans who have become reinfected with COVID-19? There may be a possible case of this in Nova Scotia. I'm just curious if you're seeing that here in our province.
We have not yet seen a case with reinfection that we believe to be a reinfection. As we know, around the world, there's many cases where people can shed the virus for a long period of time after their original illness, but we have not had any cases where we believe somebody has been infected a second time.
Operator, could you put through the next caller, please?
Our next question comes from Sammy Hudis of Post Media. Your line is open.
Hi, Dr. Hinshaw. A bit of a clarification question, but I was wondering if you can outline what has to happen before AHS can notify an organization that one of its staff or volunteers are COVID-19 positive. And I ask because we've heard about a recent case that took about 8 days. So is there any way to speed up that process so that there's a limited likelihood of close contacts further spreading the virus in those situations?
The process with respect to contact tracing in Alberta Health Services, and as you may know, we had about a month ago been experiencing some challenges with the timelines on contact tracing. So when a positive test result became available, it was in some circumstances, unfortunately, taking several days to complete that contact tracing and notify those individuals. That gap has been closed, and I've been told by Alberta Health Services that contact tracing now is able to be completed the day that that test result is available. And of course, then the follow-up with that close contacts does happen as a high priority. So if there has been a particular individual case where it's been reported that there was a delay, that would be outside of their normal practice. And Alberta Health Services might be able to comment more on that. But the typical practice would be, again, that contact tracing would happen within 24 hours of that lab result being available, and anyone deemed to be a close contact would be notified as soon as possible within, again, if not that 24-hour time period, then as soon as possible after that.
Operator, could you put through the next question, please?
The next question comes from Joel Fennick of Global News. Your line is open.
Hi, Dr. Hinshaw. We have one source telling us that there are what they describe as a substantial number of schools on Hutterite colonies with COVID-19 outbreaks in Alberta. Are you able to confirm or deny what our source is telling us?
We know that in all communities in Alberta, not just in Hutterite communities, but in all of our communities, we have community transmission happening. And when transmission happens in a community, it's not surprising that there would be a case in a school population. I don't have, again, the numbers of where there have been exposures in those individual schools, but again, we would be monitoring any individual school where there was an exposure, following up with that school and with the community to make sure that they had the information they needed to manage spread. And again, one of the things that we are doing with respect to that question of releasing specific names of schools where there has been a case identified, we are looking at the privacy implications of that in small schools, again, whether it's in a colony or a small school in another setting. There are concerns about implications and privacy breaches when we do name those individual small settings. And so again, I don't have numbers, but I am aware that there have been some cases, just as there have been cases in other schools. And we are following up as we would with any other school and any other case.
All right, operator, can you put through the next question?
Our next question comes from Curtis Garlbrath of Everything GP. Your line is open.
Thank you. Hi, Dr. Hinshaw. About the outbreak at our hospital here in Grand Prairie, are you able to share any more details with us, like what unit it is, if it's staff or patients or visitors that are sick or anything like that?
I don't have the details about whether the cases are in staff or patients. As you likely know, we have a very low threshold for identifying outbreaks in acute care or continuing care settings with just 2 cases. And so if there is any more information that's available publicly about this, Alberta Health Services would likely be the best source for that. But I do want to reiterate, again, the information that I have received is that there's no ongoing risk that there is one affected unit, that unit is on enhanced precautions, and that the rest of the hospital, there is no risk to staff or patients. And anyone thought to be exposed is being directly and individually contacted. And Alberta Health Services may have more of the specific information that you're asking for.
All right, I see actually the queue is empty, so this is one of our shorter updates. Thank you all for joining us. Dr. Hinshaw will provide another update on Monday afternoon. Have a safe weekend.